So some of the things that we can all do to maintain positive mental health. First thing, get help if you need it. This is one of the key things that unfortunately a lot of patients are not doing. Connect with others. Having a strong social support system is going to be really important. Try to stay positive, be physically active, help others, make sure that you get proper rest, and having proper coping skills when it comes to stress. Also really, really important for proper or healthy mental health. Practicing mental fitness, so collect positive emotional moments, make a point to recall times when you've experienced pleasure, comfort, tenderness, confidence, and other positive emotions. You want to learn ways to cope with negative thoughts. You want to try to focus on one thing at a time. It helps to keep calm. Exercise, really important. You want to be enjoying hobbies. Really, really important to prioritize or keep some time for things that you enjoy. You want to have goals. So goals, although they don't need to be ambitious, they help to build confidence and a sense of satisfaction when we accomplish them. Journaling really helps. Lots of research that shows it can help in terms of eating properly, getting proper sleep. But again, it really helps after a stressful day to gain perspective, release tension. Make sure that you spend time with friends. Volunteering is an excellent way to basically provide us with positive learning experience, and also helps to reinforce balance in our lives. And treat yourself well. Really, really important, of course. Okay, so now we're going to review what's happening to Pure North program participants and their mental health, both when they first come to Pure North and once they start or they enter the Pure North program. So as part of the program, we do use several questionnaires, and of course we do interviews with our patients and that allows us to track how they are doing both as an individual, and allows us to, of course, provide advice in terms of how to improve their health. As a program, we are also able to track change from Pure North participants overall, and of course, we ask about depression and anxiety. So if we look at what we find in patients here at Pure North that are answering this specific question on anxiety and depression, so we find that out of the almost 12,000 people that have answered this question, 53% reported some, so slight or above in terms of depression and anxiety. 4% reported severe or extreme depression and anxiety. After 1 year in the Pure North program, 44% of the people who had some depression and anxiety improved, 51% did not experience any change, and only 5% reported higher levels. So basically, for roughly half of the patients that enter Pure North that have some depression and anxiety, if we ask them a year later how they're doing, they've significantly improved from where they were before. Now we use, there's several questions as part of the Pure North program that look at depression and anxiety, and you can see some of those questions here. Another thing that's important is to look at nutrition, especially when we're looking at vitamin D, because we know that vitamin D is really important for mood and depression. B12 also really important for the nervous system. So here we can see where people are at when they enter the Pure North program and a year later, both for vitamin D and vitamin B12. So you can see that in terms of both levels, there's significant improvements. The people with the higher levels of depression and anxiety improve more, which makes sense. So they have further to improve, and so typically we see greater variations for the extremes. So the effect size, we're used to compare the magnitude of change between baseline and 1 year. And so that you can see that a larger effect basically is associated with a higher number. So when people had severe or extreme depression and anxiety at entry, there was a far greater improvement in terms of how they felt a year later. When there was some depression and anxiety, so not as severe, the effect was smaller, of course. Depression and anxiety improvements are related to vitamin D levels. So when we do regression analysis, basically looking at depression, anxiety, and relate that to the increase in vitamin D levels, we see that as vitamin D levels increase, so do the scores for depression and anxiety. So in terms of the overall findings here for the patients at Pure North, over half of participants reported some depression and anxiety at entry in the program. Improvements in depression and anxiety were found in less than 1 year, even in people who had low levels of depression and anxiety to begin with. 80% of people with severe or extreme depression and anxiety, when they entered the program, reported improvements after 1 year. Those improvements were very high in magnitude, so very significant improvements. The biggest differences were found when participants were able to increase their vitamin D blood levels to levels that are above 100 nanomoles per liter. So overall, the program is very effective in improving mental health. So that's it for today. I hope you found the information presented on mental health interesting. If you have any questions or if you want to find out more information about Pure North, please visit our website at www.purenorth.ca.